My name is Seth Knight. I am an allergist and clinical immunologist at Cox Health. We provide a litany of allergy services. We typically start with environmental allergies, allergies that cause nasal and eye symptoms. We typically do a skin test for that, where we'll put a whole panel on a patient's back and interpret whether or not they're reactive to certain environmental allergens such as pollen, dog, cat dander, dust, things like that. Additionally, we'll even do food allergy testing and evaluations of a similar nature. And also, we will treat food allergies with a newer treatment option that's kind of becoming a staple in our field, oral immunotherapy. And so we do that for certain food allergies depending on results and reactivity and things like that. Additionally, we evaluate asthma, so we do pulmonary function testing, and we have other advanced pulmonary testing techniques as well, and how asthma overlaps with environmental allergies. And then lastly, we also treat immunodeficiencies, and we help diagnose and manage those as well. And so helping patients who get frequent infections both reduce antibiotic use, but also stay out of the hospital. I love being a physician because really, I say we're in the human business. And so we get a unique insight in our patients' lives, and we have a role there to play, and we get to foster that relationship over time. In allergy especially, I feel like we get to further advance that relationship because we focus on the quality of life. And so what we do is really try to impact our patients' quality of life as best we can. Whether that be a 5-year-old who wants a pet and has allergies, and we help put them on immunotherapy and desensitize them or treat them and manage that. It be an elementary school child or a high schooler who plays sports and has issues with playing soccer or baseball, and certain times of the year we help them in their allergies. And certainly one of the most satisfying things that we do is helping people navigate food allergies, and potentially even telling them they may not have one or delabeling that food allergy, and really allowing them to advance their diet and add things back to their diet that they never had. And so that's really rewarding. I chose allergy for several reasons. One is having an internal medicine base. I like the broad scope of knowledge that we have and the broad scope of diseases that we treat. Most specialists focus on a particular organ system, whereas allergists treat the whole body, and we try to focus on the immune system and how it affects each and every organ. And so we do have to have quite a bit of breadth of knowledge there. Additionally, we treat kids and adults, and I really enjoy that because that helps kind of really treat all aspects of life from the beginning to the end, and I think that's a unique opportunity that we have in our specialty. Ozark area obviously speaks for itself in terms of outdoor things, and that's certainly something that I look at both for myself but also for my patients. When you talk about such a great outdoor city, you're also talking about a lot of potential for allergies. And so I thought there's a unique opportunity there, and Cox Health seemed to have a really great practice set in place for allergies specifically. When I came here and interviewed my colleague, I was blown away by the kindness and collegiality of my colleagues and how they were able to really seem to have a really well-run system there, and everybody got along well. And it seems to be that Cox really likes to invest in their physicians and their development and their careers. And so that to me was really appealing, taking a job with Cox Health out of the training. So I have a wife and a daughter, and so I love spending time with them. Me and my wife particularly love to travel, so we actually just did a trip in France. And we've been to Europe a couple times. We love to also go to national parks, and we like to hike and try to add all of those to our list. I like to play golf, when I want my own time as well. And then being from the deep south, of course I love college football. So Saturdays in the fall are a big staple in my life.